Hey, and welcome to The Explainer. Have you ever really thought about that pill you just took? I mean, how on earth does it know what to do once it's inside you? Well, today we're going to become the body's locksmiths and find out exactly how these tiny medicines really work their magic.
Seriously, think about it. How does a painkiller know to find your headache and not, say, your big toe? It almost seems like magic, right? That question is the central puzzle we're going to solve together today.
Well, the secret isn't magic at all. It's actually much more about mechanics. The entire, incredibly complex science of pharmacology can basically be boiled down to one really simple, elegant metaphor: a lock and a key. And that idea is the foundation for everything we're about to cover.
Okay, so if our bodies are full of all these locks, it only makes sense that medicines act as the keys. But here's the thing. It turns out not all keys are created equal. Let's dive into the two main types.
So on the surface of our cells, we have these things called receptors. For our purposes, just think of them as tiny, very specific locks. A medicine, that's our key, is designed to travel through the body until it finds and fits into one particular lock. When that key clicks into place, it triggers a very specific action inside that cell. The first type of key we need to talk about is an agonist. You can think of this as the perfect master key. It doesn't just fit into the lock, it turns it all the way, firing up the cell and producing the strongest possible effect. An agonist is the go signal.
And you know, just like in real life, not every key is a perfect fit. There are also what we call partial agonists. Now these keys, they fit the lock all right, but they can only turn it a little bit. They still cause an effect, but it's a much weaker one compared to what a full agonist can do.
Now, for the second major type of key, the antagonist. Imagine having a key that slides perfectly into a lock, but it's the wrong shape to actually turn the bolt. It just sits there, completely jamming the keyhole. Well, that's exactly what an antagonist does. It blocks the lock, which prevents any other keys, including the ones our body makes naturally, from getting in and causing an effect. This is the stop signal.
So really, when you strip it all down, it's pretty straightforward. An agonist turns the lock on, an antagonist jams the lock, keeping it off. One activates, the other one blocks. And this fundamental push and pull is the engine driving countless medications we use every single day.
But here's where things get really interesting. Our bodies are incredibly dynamic. They don't just sit back and passively accept all these keys, they actually fight back. And over time, they can start to change the locks themselves.
Okay, so if you're continuously using an agonist, constantly turning a certain lock on over and over, the body starts to get overwhelmed. Its response? It starts removing some of those locks, or just makes them less sensitive. This is a process called downregulation, and it's the simple reason why some drugs seem to lose their punch over time. It's literally your body building a tolerance.
And you guessed it, the exact opposite happens with an antagonist. If you're constantly blocking a receptor, your body starts to think, hey, I'm not getting this really important signal. So what does it do? It builds more locks, or it makes the existing ones extra sensitive. We call this upregulation, and it's precisely why suddenly stopping certain medications can be so dangerous. All of those extra super sensitive locks are suddenly wide open and the body's natural keys rush in, causing this massive, exaggerated rebound effect.
This brings us to a really critical topic: dosage. See, it's not just about finding the right key for the right lock, it's about using just the right amount of pressure to turn it.
This right here is a core principle of pharmacology. The effect of a drug isn't some on-off switch. It's much more like a dimmer. A small dose gives you a small response. A larger dose gives you a larger response. Up to a certain point, of course. It's all about finding that therapeutic sweet spot.
So how do we measure the safety of that sweet spot? We use something called the therapeutic index. You can basically think of it as the drug's safety window. It's the gap between the dose that helps you and the dose that could start to harm you.
Some drugs have a really wide safety margin, a huge gap between the effective dose and the toxic one. But for other drugs, that gap is tiny. They have what's called a Narrow Therapeutic Index, or NTI, and that's where the line between helpful and harmful is razor thin.
And these are not obscure drugs either. This list includes really common medications, things like blood thinners, seizure medications, and thyroid treatments. For patients who are on these NTI drugs, there's just no room for error. And that's why they need such careful, constant monitoring to make sure they stay right in that narrow safety window.
Okay, for our final section, let's clear up a really common point of confusion. When we talk about how good a drug is, are we talking about its raw power, or are we talking about its precision? because they are two very, very different things.
First, let's talk about efficacy. When you hear efficacy, I want you to just think of one word: power. Efficacy is the absolute biggest effect a drug is capable of producing, no matter how much of it you take. It's all about the maximum possible response.
Now, potency is different. This is all about precision, or you could say sensitivity. Potency is simply the amount of a drug you need to get an effect. So for example, if drug A works at 5 milligrams and drug B needs 10 milligrams to do the exact same job, then drug A is more potent. It's not necessarily stronger, it's just more efficient at a lower dose.
So let's recap that one more time. Efficacy is pure power, the biggest possible effect you can get. Potency is precision, the amount of drug you need to get there. For instance, one painkiller might be more potent, meaning you only need a tiny pill, but another might have higher efficacy, meaning it can relieve more severe levels of pain.
And this is maybe the single most important takeaway from this entire explainer. Stronger or more potent does not automatically mean better. Not at all. A drug that's incredibly powerful might also come with absolutely unbearable side effects. You know, a sledgehammer is powerful, but you don't use it for delicate work.
In the real world, choosing the right medication is a complex balancing act. Doctors are considering its power, sure, but they're also looking at its side effects, its safety window, how long the effect lasts, how many times a day you have to take it, and yeah, even how much it costs. It's about finding the best overall fit for the patient and for their life.
So the next time you think about medicine, maybe you'll see that invisible science at work, that careful, intricate search for exactly the right key, for exactly the right lock, at exactly the right time. Thanks for watching The Explainer.